Are you ignoring the silent cries for help from one of your body's most essential organs? Today, we uncover the critical signs your liver is struggling, which could save your life. Stay tuned to learn how to spot these warnings before it's too late. Welcome to Health and Well-Being Channel, where we decode the signals your body sends when it's in distress. In today's episode, we're diving into a crucial yet often overlooked organ, the liver. Your liver is a powerhouse of activity, crucial for filtering toxins, aiding digestion, and regulating metabolism. But what happens when it starts to falter? How does it communicate the trouble it's in? Let's get started and uncover what your liver's distress signals might be trying to tell you. And if you find our content helpful, please like, subscribe, and share this video to help others become more liver aware. Together, we can make a difference in our health and well-being. Here are 10 warning signs your liver may be in distress. 1. Jaundice. Jaundice stands out as one of the most evident and alarming signs of liver distress. It manifests through a distinctive yellowing of the skin and the whites of the eyes, which is not only visually striking, but also indicative of significant health issues. This symptom arises when the liver, which normally processes and disposes of bilirubin, fails to do so effectively. Bilirubin itself is a yellowish pigment that is created from the breakdown of old red blood cells. In a healthy, functioning liver, bilirubin is metabolized and then excreted in bile, which is released into the intestines to aid digestion. However, if the liver is damaged or compromised by conditions such as hepatitis, cirrhosis, or liver cancer, its ability to handle bilirubin is impaired. As a result, bilirubin builds up in the bloodstream and deposits in the skin and eyes, giving them a yellow hue. This process not only signals liver malfunction, but also necessitates prompt medical attention to identify and treat the underlying cause of the liver's inability to process bilirubin efficiently. 2. Abdominal pain and swelling. Abdominal pain and swelling in the upper right section of the abdomen are key indicators of potential liver distress. This area is crucial because it houses the liver, a vital organ deeply involved in metabolic processes and detoxification. When the liver becomes inflamed, a condition known as hepatitis, or when it enlarges, referred to as hepatomegaly, it can cause noticeable discomfort and a visible increase in the size of the abdomen. This swelling is not just due to the liver increasing in size. It often involves fluid accumulation in the abdominal cavity, a condition known as ascites. Ascites and hepatomegaly can exert pressure on other organs and the abdominal wall, leading to pain and a sensation of fullness or bloating. Such symptoms are particularly concerning because they suggest that the liver's functionality is compromised, possibly due to infection, fatty liver disease, or more severe issues like cirrhosis or liver cancer. If you experience these symptoms, particularly if they are accompanied by other signs like jaundice, dark urine, or changes in stool color, it's important to seek medical evaluation promptly. Early diagnosis and intervention can significantly impact the management of liver conditions and help prevent further deterioration of liver health. 3. Dark urine. Dark urine can be a significant indicator of liver dysfunction, serving as a visual cue that something may be amiss with this vital organ. Typically, the liver filters out waste products from the blood, including bilirubin, a pigment that results from the breakdown of hemoglobin in old red blood cells. In a healthy liver, bilirubin is processed and excreted into the bile, which eventually helps to give stool its normal color and is partially responsible for the typical yellow color of urine. However, when the liver is compromised, whether due to disease, damage, or dysfunction, it may not process bilirubin effectively. As a result, excess bilirubin can accumulate in the blood and subsequently be excreted in higher concentrations in the urine, giving it a much darker appearance than usual. This change is often one of the early warnings of liver trouble and should not be ignored. Dark urine, especially if accompanied by other symptoms like light-colored stools or yellowing of the skin and eyes, warrants immediate medical evaluation to assess liver function and to rule out serious conditions. 4. Loss of appetite. A loss of appetite can often be a subtle yet concerning signal from your liver that it's not functioning optimally. One key role of the liver is to produce bile, a crucial digestive fluid that helps break down fats and aids in the absorption of vitamins A, D, E, and K. Bile also plays a significant role in making your meals feel satisfying by facilitating digestion. When the liver is impaired, its ability to produce adequate amounts of bile can be compromised. This reduction in bile production can lead to difficulties in digesting fats and absorbing nutrients, which in turn can cause a decrease in your desire to eat. Without the normal secretion of bile, the digestive process becomes less efficient and less effective, making eating a less appealing activity. This drop in appetite, while it might seem minor, can have cascading effects on your overall health, leading to nutritional deficiencies and weight loss. It's a sign that shouldn't be overlooked, as it often indicates that the liver is struggling with its critical functions. If you notice a persistent loss of appetite, especially if accompanied by other symptoms like fatigue or abdominal discomfort, it's advisable to consult with a healthcare professional to explore the underlying causes and ensure that your liver health is adequately assessed and managed. 5. Fatigue and weakness. Experiencing ongoing fatigue and weakness could be a subtle yet significant indicator that your liver is struggling to perform its vital functions, particularly in its role in energy metabolism. The liver is integral to various metabolic processes, including glycogen storage, glucose metabolism, and the breakdown of fats and proteins, which all contribute to energy production. When the liver is impaired, due to conditions such as hepatitis, fatty liver disease, or cirrhosis, its ability to manage these metabolic functions efficiently can be severely hampered. This inefficiency can lead to a depletion of your body's energy reserves, manifesting as persistent tiredness and general weakness. These symptoms can be debilitating and may not only reflect the direct impact of reduced metabolic function, but also an accumulation of toxins in the blood that the liver would typically filter out. Fatigue and weakness, while common and often attributed to many causes, when persistent and accompanied by other symptoms like abdominal discomfort or jaundice, should prompt consideration of liver health. Addressing these symptoms early with medical guidance can help in diagnosing underlying liver issues and preventing further health complications. 6. Nausea and vomiting. Nausea and vomiting can often be overlooked symptoms, but when related to liver health, they signify something potentially serious. The liver plays a critical role in detoxifying the body by processing and eliminating toxins and metabolic waste. It acts as a filter for harmful substances consumed or produced within the body, converting them into harmless materials or ensuring they are released from the body effectively. When the liver is not functioning properly, due to diseases such as hepatitis, cirrhosis, or liver failure, it can fail to detoxify the body adequately. This failure leads to the accumulation of toxins in the bloodstream, which can stimulate the brain's vomiting center and cause feelings of nausea and episodes of vomiting. These symptoms are the body's way of responding to the toxic buildup. This response is not just uncomfortable, but also a clear alert that the liver may be compromised. Persistent nausea and vomiting, especially when accompanied by other signs of liver distress like jaundice or swelling, should be addressed with a healthcare provider promptly to assess liver function and prevent further damage. 7. Bruising or bleeding. If you find yourself bruising or bleeding more easily than usual, it could be a critical sign that your liver is not functioning properly. The liver is essential in the production of various blood clotting factors, proteins that help to control bleeding. When the liver's health is compromised, its ability to synthesize these proteins diminishes. Diseases such as cirrhosis, hepatitis, or liver fibrosis can damage the liver, impacting its functionality and reducing the production of clotting factors. This reduction makes you more susceptible to bruising from minor bumps or injuries and can lead to prolonged bleeding even from small cuts or abrasions. Additionally, in severe cases, it might cause spontaneous bleeding, which can be life-threatening if not addressed. Such symptoms of easy bruising and unusual bleeding patterns are significant because they not only indicate potential liver disease, but also pose immediate health risks. If you observe these changes in your body, it's crucial to consult with a healthcare provider promptly. Early diagnosis and treatment can prevent further liver damage and manage the symptoms effectively, safeguarding overall health. 8. Mental confusion. Mental confusion can be a profound and distressing symptom of liver disease, signaling a severe complication known as hepatic encephalopathy. This condition arises when the liver, compromised by disease, fails to adequately filter toxins from the blood. Typically, a healthy liver breaks down and removes harmful substances from your system, but when its function is impaired, due to conditions like cirrhosis or acute liver failure, these toxins accumulate. One of the most critical substances is ammonia, a byproduct of protein metabolism, which the liver usually converts into urea for safe elimination in urine. However, when the liver cannot process ammonia effectively, it builds up in the bloodstream and crosses the blood-brain barrier, affecting brain function. This can disrupt neural communication, leading to symptoms ranging from mild confusion and altered mental states to severe cognitive impairment and coma. Mental confusion associated with liver disease is a serious indicator that the liver's condition has deteriorated significantly. It requires immediate medical attention to manage the buildup of toxins and to support liver function, potentially averting more severe neurological consequences. 9. Fluid retention. Fluid retention, particularly swelling in the legs, ankles, and feet, can be a significant indicator of liver problems, manifesting as a condition known as edema. The liver is integral to maintaining fluid balance in the body by producing proteins such as albumin, which help keep fluid in the bloodstream. When the liver is damaged or diseased, its ability to produce these proteins diminishes, leading to an imbalance that allows fluid to leak out of the blood vessels and accumulate in body tissues, primarily in the lower extremities. This swelling is not only uncomfortable, but can also be a sign of advanced liver disease, such as cirrhosis, where liver scarring inhibits normal blood flow through the liver, increasing pressure in the portal vein, portal hypertension. This increased pressure further contributes to fluid leakage. Additionally, liver disease can compromise kidney function, exacerbating fluid retention. Such symptoms of swelling and fluid retention are serious and warrant prompt medical evaluation. They can indicate both a direct issue with liver functionality and secondary effects on the circulatory and lymphatic systems. Managing these symptoms effectively requires addressing the underlying liver condition and may involve lifestyle changes, medication, or more intensive treatments depending on the severity of the liver damage. 10. Itchy skin. Itchy skin can often be a less recognized yet troubling symptom of liver difficulties. The liver is essential for detoxifying the body by filtering out various toxins and waste products from the blood. When the liver's function is impaired due to conditions like cirrhosis, hepatitis, or liver fibrosis, its ability to cleanse the blood of these harmful substances diminishes. As toxins accumulate in the body, they can cause various systemic reactions, including skin irritation and itching. This itching isn't like the fleeting irritation caused by a mosquito bite. It's persistent and pervasive, often worsening without specific triggers and continuing over extended periods. It can significantly impact the quality of life, causing discomfort and distress. The mechanism behind this involves the buildup of bile salts and other toxins that, when deposited in the skin, stimulate nerve endings and lead to the sensation of itchiness. If you experience persistent itchy skin along with other symptoms such as jaundice or fatigue, it's crucial to consider liver health as a possible underlying cause. Consulting with a healthcare provider for a thorough evaluation and appropriate testing is important to address potential liver issues and alleviate the discomfort associated with itchy skin. And there you have it, the key signs to watch for when your liver may be in distress. Today, we've uncovered how symptoms from jaundice to itchy skin can signal issues within this essential organ, highlighting the importance of being attentive to what our bodies are trying to tell us. Remember, recognizing these signs early can be crucial in addressing liver health proactively. Don't forget to like, subscribe, and hit the notification bell for more health insights. Take this knowledge, stay vigilant about your health, and ensure your liver is functioning as it should. Stay healthy, stay informed, and I'll see you in the next video.